So, Toby, thanks for joining me today. So, first of all, as someone focused on working with 1,000 hospitals in this area, what are some of the challenges that they're facing today when it comes to acute care? And
Well, that's an easy question with a difficult answer. The reality is that it's the high labor costs coupled with the low employment or the employment shortage that's out there is actually a better way of saying that. And that is really what's the biggest problem. For example, 52% of nurses are currently considering leaving the bedside at a time when there are already 1.1 million openings in this industry.
that's amazing.
Yeah, it's crazy. And this is something where hospital leadership have recognized that this is not sustainable, that this is a situation where really the way we've been doing it just isn't working anymore. And experts say that 83% of hospital leaders are actually considering other options. The biggest one is virtual nursing as a possible solution for this issue.
So, tell me about virtual sitting a little bit.
Sure. So, and really they're considering virtual nursing as much as virtual sitting. Both of them will address this. And so the way that virtual sitting works is it uses technology to try to address problems that then in the past required one-to-one sitters. So for instance, you would roll a mobile telesitter unit into a room, and then somebody could monitor them as well as many other patients remotely. So you take a situation where you used to have one-to-one sitters, and now you can have one-to-many or 1-to-12, for instance. And what they would do is they would be able to monitor the patient's behaviors and the activities that are occurring in the room for adverse events. So some examples of adverse events might be falls or an elopement, possible self-harm, or even staff abuse. And yeah, and so that's what telenursing, virtual sitting is. Yes. So virtual nursing, on the other hand, would you like to hear about that?
Sure.
Okay. So virtual nursing really refers to using the same system to, instead of taking somebody who is used as a sitter and having them remotely monitor multiple patients, what you're doing is you're taking a nurse and they're able to work remotely and be able to monitor a much broader base of people. And so there are two major use cases where you do that. One is what we call clinical resource nursing, and the other one would be expert oversight. And so when you look at it from the perspective of virtual nursing, clinical resource would be like using a nurse remotely to do admissions and discharges by rolling the mobile unit into the room.
Okay.
Whereas something like expert oversight might be a situation where a senior nurse could provide some mentorship to some newer nurses, or they can also be used for things like rapid deterioration. So, for example, at UC Health in Colorado, they've actually been able to reduce code blues at their hospital by 70%.
Wow.
Using virtual nursing. Yeah.
That's fantastic. I would imagine also in situations where it's tough to keep track of people, like, for example, people who might be on the spectrum who are confined to a facility and need to be watched all the time. This could leverage that talent to multiple patients at the same time.
Absolutely, yes. It can be used in that type of a situation. There are limited situations where behavioral health can be monitored using the virtual sitting. Absolutely.
So what's the big difference between virtual nursing and virtual sitting then? What are the major differences?
Yeah, so the major differences are kind of what I've already talked about, where virtual sitting uses that technology to address the situations that would have been monitored by a one-to-one sitter.
Right.
So if you look at it, that it's really all about stopping adverse events is the idea.
Sure.
And so, for instance, falls is the biggest one of those. And falls is a situation that is considered a never event in the hospitals. And for example, at Northern Westchester Hospital has actually reduced their falls by 60% using virtual sitting. Yeah. Whereas virtual nursing, as we mentioned earlier, refers to having the nurse be remote, rolling the same technology into the patient room and being able to monitor and help out the nurses there. So either, through the two different use cases of expert oversight or clinical resource, they're able to assist the on-site hospital staff with that.
So we're hearing a lot at HIMSS this week about AI and its applications. How does AI fit into this kind of acute care that you're talking about?
That's a great question. So AI, I'm very excited about, I'll tell you. As an engineer, as a CTO, AI is going to just change the world. It's going to be an exciting area. And AvaSure, we are investing significantly in this area. However, the situation that AI is at, specifically in relation to virtual care, virtual nursing, and virtual sitting, is that it will most likely be a computer vision type of an application.
Makes sense.
Yeah. The issue, though, is one of accuracy. And so it's not at a point, AI is not at a high enough point yet where it can be standalone, replacing people. So really, AI is going to start out, at least, by being able to assist the staff that are currently monitoring, so that maybe they can monitor more patients, or that we can reduce even more adverse events by helping to watch for indicators that perhaps the human eye might have missed. So that's how we'll start out with AI.
What are some of the hard lessons that IT has learned in this journey towards better virtual care?
There's a lot, honestly. But the biggest one that comes to my mind is, I would say, don't try to do it yourself. Don't DIY it. We've been doing this for 13 years, and over those 13 years, we've had a lot of very hard lessons. And we pride ourselves on making it look very simple, but the reality is that this is a very complex system, especially to work in an acute care environment. And so what looks like, hey, this could be really easy, I can just go buy a couple things, it's not that easy. And there's a lot more to it. And so the biggest thing I would say is, don't try to do it yourself. Go to get help with that. The second thing that I would say is, and this is a little bit about AvaSure, is that when we sell it as a system. We don't just sell hardware that we just chuck over the wall and you're on your own. We're there to help. We're going to stay with you until you're successful.
Right.
And so what I would tell IT leaders is, if you work with us, we would be able to make sure that we're there with you, and we'll make sure you're successful, and we'll make it so that you can focus on other things, so that you don't need to worry about this, because there are so many difficult things that IT leaders need to deal with in the acute care environment.
Get one more thing off your plate is always a good thing.
Absolutely.
Just a motion detection camera alone is not going to cut it.
Exactly.
So I guess I'm going to take that Ring doorbell out of my grandpa's room now. Okay. Toby, thanks so much for your time today. I hope you have a great show.
Thank you. Looking forward to it.
See you later.
Thanks.